Hello everyone, welcome to the tutorial for Fundamental of Pharmacology. This is week 1 for the basic review for drug calculation. We're going to review the 6 rights of drug administration. The first is right medicine, the second is right dose, the third is right patient and right route, right time, and right documentations. So make sure that once you're giving medication, you choose the right medicine. And then the time is right with the correct patient, and the route is right and at the right time with the right documentations afterwards. Now let's review the metric system. So we have what we call base units. For example, length, we have meter, weight, we have grams, capacity, we have liter. So the meter is the metric base for unit length, and gram is the metric base for the unit of weight, and then liter is the metric base of the unit for capacity. So these are the things that we are often used as we learn pharmacology. Next is remember the metric system for drug calculation. We use kilo, hecto, deca, and base unit, which is millimeter, which is meter, gram, and liter, and then deci, centi, and milli. So we have the smaller unit and we have the bigger unit. And remember that if we go down, we are going to multiply with 10, and when we are going up, we are going to divide it by 10. And this is a very common conversion system in drug calculations. So for the weight, you have gram, and then you have milligram, and then you have microgram, and then you have kilogram. So 1 gram is 1000 milligrams, and it's 1 billion micrograms. And then when you have milligrams, it's like 1000 micrograms. And when you have 1 micrograms, it means it's 0.001 milligrams. And when you have 1 kilogram, it's 1000 gram. The same goes with liter as a volume. So you have 1 liter, which is 1000 milliliters. And you have deciliters and you have milliliters. And with the length, we have meter. So 1 meter is 100 centimeter, and it's 1000 millimeters. And it's also 1 centimeter equal to 10 millimeters, and it's it's also a 0.1 centimeter equal to 1 millimeter. Now, we have what we call international unit in drugs calculation. So some medication, it measured in international units, IU, and some also just use the letter U. So here's the example. We have heparin in package. We have a vial of 225,000 unit per 5 milliliters. So if you see here, we have 25,000 EU in international unit in 5 milliliters. So it is 5,000 unit in 1 milliliter. And here we also see the insulin. So we have here 100 units per milliliter. So 1 milliliter of this insulin contain of 100 units of insulin. Next one, we go for the drop factor. So we have what we call macro drip and we have what we call micro drip. So the macro is bigger one, it's bigger chamber, bigger drip, and micro is like the little one, like a thread needle, and is smaller. So micro drip usually used for adult patients. It can be like 10 drops a milliliter, or 15 drops a milliliter, or even 20 drops a milliliter. You just have to read the measurement. And we have what we call micro drips. This is for pediatric patients, and the drip factor will be like 60 drops per milliliter. So it's like very, very tiny. Now let's see. This is the macro drip infusion. So it will be bigger like this. And then you can see here it's 20 drops per milliliter. It means that the drop factors is 20 drops per milliliter. And you can also read here is 15 drops per milliliter, which is the drop factor will be 15 drops per milliliter. So always at the all the time you will read the package and it will be stated there whether this is a macro drip factors or micro drop factors. So you have to check the drop factors on the chamber, sometimes it's here, and also on the packaging. Now, this is the macro. This is the micro drip factor. So you'll have the needle in the drip chamber to make it smaller. And you'll see here it's 60 drops per 1 milliliter. So you'll always check the drips here and you'll see the needle. Check the drop factor again on the chamber and also on the packaging. Now let's talk about intravenous therapy for administration method. So we have the bolus injection. It's the one that you like inject it straight to the vein. And we have the intermittent infusions that one time is on, one time is off. And we have the continuous infusions that go throughout like 24 hours. Now, you can do the bolus injection. Example, administer a single injection in a small volume concentrated solution given directly to the intravenous intermittently. So sometimes it's like 3 to 10 minutes depending on the type of drugs, and most commonly given in conditions of emergency faster according to the drug actions, and you can give it manually using a syringe or use the syringe pump. So for example, if you're going to inject analgesic drugs, we can say thoracic injection 3 times a day with 30 milligrams IV bolus. It means you're injecting it 3 times a day in one syringe. Next one is intravenous therapy administration method. So you have what we call three-way stopcock. And the one with the blunt, the one without the tip, is the one that is stopping. So if you see like this one, it means like it's open in each way. Okay, so you don't use needle, you just use the three-way, and then there's like the stop everything. And if you're going to give injection using needle, it can be like this or even to the side of a three-way like this way. This is a bolus injection technique. Now let's see the intermittent infusion. So intermittent infusions means that you insert a drug in a small volumes or 50 to 250 infusions given between 15 to 2 hours. And this is one specific dose, and sometimes it determines the volumes of the diluents. So for example, you're going to administering antibiotic drug, for example, ceftriaxone 2 gram BD and IV drip in an hour on a piggyback. Next one is, this is the piggyback. As you can see, it can be like this, it can be also like this. A piggyback is an IV fluid bottle containing 25 to 250 milliliter, or a bottle connected to a shorter tube of the Y port of the primary or intermittent intravenous infusions line. The continuous infusions, meanwhile, is the constant rate of infusions that happen in a specific period of time, given over several hours or even several days. For example, we are administering potassium chloride and we do the KCl of 50 meg in liter and an ACL 0.9% 500 milliliters almost like 24 hours. Now, you need to review the IMRs or the medications record on the YouTube link that is at your learn. Thank you. This is the reference and happy learning.